results show also that there are some subgroups in the population that may be genetically more susceptible to some types of cancer. And this is the example of folate, because we yesterday talked about folate. That shows that if we divide the population in 3 subgroups with according to this gene, there is one group of the population that even eating folate won't get any protection on gastric cancer just because they are carriers of a certain type of genotype. So when we talk about giving people folate in the massive way at a public level, we don't have in mind that there are some subgroups that are won't be benefit or even don't receive any benefit of these kinds of guidelines. So what is the government in Mexico doing in regard to this? We have only three in the National Program of Health, 3 directions, specific directions in relation to cancer. One is to reduce cervical cancer, the other is to increase mammography, and the other just to provide practical guidance. I'm going to just be very brief with each one. Regarding cervical cancer, by law, these actions should be taken in any center in Mexico City. Provide pap smear, try to repeat cytologies if they are not adequately taken, and give in a shorter possible time the result to the women, etc. So that has been working, and we are seeing now the reduction in mortality in this cancer. Recently, the breast cancer guidelines were revised, and because we have a huge problem with this, the coverage of mammography in our country is only, currently less than 20%. That means that 80% of women won't have mammography in the following years. So it's a problem not only of lack of resources, but also of education, demand, offer, a very complicated one. But the guideline was revised, and now by law the mammography should be offered in this group of years every 2 years, and for 70 and up only among survivors. So there was a very strong civil movement against this new guideline. Everybody wanted to keep the previous directions, but because of lack of resources, the government had to make these changes. Mainly lack of resources, but there were other reasons. And regarding other cancers, we are following mainly the guidelines of the American Cancer Association that you know better than me: prostate, lung, colon, stomach, testicle, pancreas, and so forth. The point is that if, according to the national surveys that the institute where I work has performed, today in our country, about 50% of the population is somehow related to smoking. Alcohol is present in about 30% of the population, and obesity is becoming a leading cause of death. So if we don't make a major change in the following years, the situation with cancer and also cardiovascular disease, because these are risk factors for both, will increase. So I had this opportunity to participate in an international effort that is being leading by people in Harvard University in the United States, and they are creating this task agenda to try to close the gap between rich and poor countries in the fight of cancer. Because, as you know, cancer was, used to be linked to urbanization, to rich countries, but no longer. Now we are seeing that poorer countries are facing this disease at the same time they are facing infections and other types of diseases. So what was very interesting for me is that in this effort, in this innovative effort, what they are proposing is to try to link the health promotion that we were talking yesterday, but in anti-poverty programs. So not only to see health promotion and education and in one arena, but also poverty, because they are seeing that poverty is one of the main reasons that determine the following cascade that ends with in cancer. So not only in prevention, but also promoting early detection in anti-poverty programs, diagnosis, and so forth. And in treatment, what is really interesting is that there has been some innovative methods, for example, to provide chemotherapy at home, to deliver some types of chemotherapy treatments at home. Now in the state of Jalisco, in Mexico, they are running a pilot study of this, and we will have the results soon to see if that works, to be more effective in this area. And also, new ideas from this group are that we should try to enroll families and relatives and friends and community to provide support to survivors. So there are some nice proposals that may help in the coming future to try to close the bridge between different countries. But meanwhile, in Mexico, we did some models and estimates, and if we think that if no major preventable interventions occurring very short in our country, 6 out of every 10 Mexicans will die due to one of the following diseases by 1230. Diabetes, cerebrovascular diseases, heart-related diseases, and cancer. And it's urgent that our authorities now take this into account, because cancer is taking a lot of daily. Thank you.